I'm Hope Watkins, and today I'll be talking about Ebola hemorrhagic fever. Imagine, a person is lying in a hospital bed, vomiting, but they're too weak to make it to the bathroom. This could be any number of diseases. But this same person has developed a rash and started bleeding from his gums. Now, the signs point more to Ebola hemorrhagic fever. If you turn on the news right now, you'll more than likely hear something about Ebola, since there's been an outbreak in Africa, and there have been a few cases in the United States as well. The first report of Ebola was in 1976 in a village near what was known as the Ebola River, which was how the disease got its name. There are actually 5 different strains of the virus, but only 4 of which are lethal. People everywhere are talking about Ebola, but how much do we really know about it? The public needs to know certain things about the disease, such as what the disease really is and how it can be transmitted, the different signs and symptoms of the disease, and the ways in which it can be treated. The Ebola virus is what causes Ebola hemorrhagic fever. It is a type of viral disease. The symptoms of this virus are not specific early on, but often there is an internal and external bleeding or hemorrhaging later on as it progresses. The Ebola virus disease is ranked as one of the most deadly or lethal viral infections known. It is considered as such because of the mortality rate, which is considerably high during outbreaks. The reason for the high mortality rate is that Ebola hemorrhagic fever is transmitted through direct human-to-human contact, such as through broken skin or mucous membrane. It can also be transmitted through contact with environments that have been contaminated. There are actually 2 different symptoms when dealing with Ebola virus. The early symptoms include fever, headache, weakness, vomiting, diarrhea, stomach discomfort, decreased appetite, joint and muscle discomfort. These seem like pretty nondescript symptoms, right? Well, that's because they are. The virus can look like any number of other diseases while still in the early stages. Other symptoms will start to appear as the virus progresses. These later symptoms may include a rash, redness of the eyes, hiccups, a sore throat, cough, chest pain, difficulty breathing and swallowing, and bleeding from both the inside and outside of the body. The bleeding will usually occur from an area such as mucosal surfaces in the eyes. A person can begin to show signs of the Ebola virus anywhere from 2 to 21 days after they're exposed, with the average being between 8 and 10. There isn't really any true treatment for the Ebola hemorrhagic fever. The best that health professionals can do for a patient with this disease is supportive therapy. Supportive therapy includes balancing fluid and electrolyte levels, treating any other infections that the patient may have, and maintaining their oxygen and blood pressure, as well as replacing the blood that's lost. When a person is suspected of having Ebola, they're usually isolated or quarantined, so as not to spread the disease to anyone else in their area. Even the healthcare professionals that are supposed to be treating a patient with Ebola hemorrhagic fever are required to wear protective clothing. Another reason this disease can spread so rapidly is because there's no vaccine or specific treatment for it. We don't really know what it is. I think it's fairly safe to say that we still have a lot to learn about Ebola hemorrhagic fever. We may know what it is and what the signs of it can be, but what does that really matter if we don't understand how to treat it? Like I stated earlier, Ebola is a viral infection that can be spread through human to human contact, and that the symptoms are quite nonspecific early on. It's also very lethal, and there isn't a treatment other than therapy. Now, if you have a headache or fever, or some other symptom I listed earlier that are in the early stages of Ebola, please do not immediately think that you have Ebola. It's more than likely something else. But if you start bleeding from someplace that you shouldn't be, like your eyes or your mouth, then yeah, you should probably go see a doctor immediately. My information was gotten from the World Health Organization, the CDC, and the National Health Services. Thank you.